We recently added acupuncture to Rachel's treatment plan and have learned a lot about it and seen some of the benefits already. We want to talk about that with you and make sure you had this important information. All right, let's dive in. First off, obviously, I am not a doctor. Anything I say should not be taken as medical advice. I say this on just about every video we talk through, so I'm not going to belabor that point any longer, but do not take my word for it. Look into it yourself, talk with your doctors. Okay, we're talking about acupuncture. I want to cover some of what just generally acupuncture is, just in case anyone isn't entirely sure or just hasn't connected the dots on what it means. I want to talk the general benefits that people agree on, and then specifically how acupuncture is used in a cancer environment, both from a Western medicine standpoint and maybe from more of an integrative standpoint, some of the benefits that are at least claimed on the integrative side. All right, but first let's dive into what is acupuncture. Acupuncture involves the insertion of really thin needles through your skin at strategic points in your body. It's been around for thousands of years, primarily in Chinese medicine, and traditionally they explain it as a technique for balancing the flow of energy or life force, here qi. So that's how the real Chinese culture for thousands of years understood the effect that acupuncture was having. Now, in contrast, many Western practitioners view these same points, these acupuncture points, as really just places where you can stimulate nerves and muscles and connective tissue. And so you can kind of see how culturally it was understood in one way, that as science catches up, we understand that there actually is some truth to that. Where it might be described as a flow of energy, we can now understand that may be access to a nerve point that affects where that nerve tree is going through your body. And so that's how we understand acupuncture to be something that affects our bodies. So let's talk some of the general benefits of acupuncture. So acupuncture stimulates the release of endorphins, which is the body's natural pain-relieving chemical. So just whether, if you think of like a back massage, when you stimulate something, you induce a level of pain or discomfort that releases endorphins in your body that are relaxing and have a lot of great benefits. And so at a really simple level, that's what acupuncture does. Acupuncture also is understood to influence the autonomic nervous system, which the autonomic nervous system is the network of nerves throughout our body that control unconscious processes. So like I just took a breath right there. I didn't choose to take that breath. I didn't consciously think I have to make sure I breathe. My body just knows what to do and when. My heart is beating, I'm breathing. When I sleep, I don't have to remind myself to breathe. My autonomic nervous system is there to ensure that those processes happen. And so when we think about acupuncture influencing that autonomic nervous system, it's actually really unique because I can't do that mentally. I can't influence my autonomic nervous system directly. I can't say, heart, stop beating, but I can impact that nervous system using acupuncture to affect things like breathing, blood pressure, heart rate, and some other things. And so that's how we understand acupuncture to work. It is often used, just generally, for things like anxiety, joint and inflammation related pain, depression, headaches, nausea, even skin health. And so you can see how, especially like the anxiety and depression piece, as you're affecting your autonomic nervous system, you're able to affect things that are inducing that anxiety or depression. You're able to release endorphins and change how you actually feel because of the physical effect that acupuncture is bringing about. So that's how acupuncture is used. But I want to talk this last couple minutes we have specifically about acupuncture for cancer. So in Western medicine, this is widely agreed that acupuncture can be used for these purposes: nausea and vomiting related to chemo and radiation. There have been many studies that show that acupuncture can help reduce those effects of chemo and radiation. And it's kind of a no-brainer to use it alongside the traditional Western treatments that you're undergoing. It also has been shown to manage pain around either the tumor in your body, like if that's causing physical pain, or even just pain from a surgery that you've been through. The recovery of that, acupuncture can be used to help manage that pain. It also generally works for like muscle and joint pain relief. So as you go through body aches and just muscular issues as you're going through cancer treatment, and you're not able to move as much as maybe you used to, and you get stiff, acupuncture can help with that as well. It's been shown to mitigate the effects of neuropathy. That tingling in your fingers and your feet, the numbness that many people go through, particularly with chemotherapy, but also with radiation, that acupuncture can help protect. It's a neuroprotective function that can protect against that neuropathy. It can also help with hot flashes and hormone imbalances. This is particularly with women with breast cancer and men with prostate cancer. It's a hormonal cancer, and so your hormones are out of sync from what your healthy body may naturally have. And so part of that is that acupuncture can assist with managing that and the effects of that, like hot flashes. The two other things are both kind of two sides of the same coin. Acupuncture can assist with counteracting fatigue, so the tiredness that you feel alongside cancer treatment. But also on the flip side, it can counteract insomnia, the inability to sleep, and can help you calm your body, calm your heart rate, calm your breathing, bring you to a place of rest. And so it can be a really useful thing as your body is undergoing things it has likely never gone through, and you are struggling to counteract the effects of those really caustic treatment options that are fighting the cancer, but also affecting your body in really negative ways. Acupuncture can help. Now, there is one thing that is not widely agreed to. There's one thing that is not widely agreed upon, and that's in the integrative medicine side of things. There is a belief and an understanding that acupuncture can also stimulate your immune system. That essentially, when you are irritating that area, you are stimulating the immune system to respond. It's a really small wound, essentially, that you're introducing that causes your immune system to flare momentarily or in a short period of time, but also then retrain itself to be on high alert. And cancer is often a failure of our immune system to recognize and counteract the cells that have mutated. And so anything we can do to boost our immune system becomes a really powerful benefit in the fight against cancer. And so this is one that has been studied less. It's hard to quantify in a studied environment because we're starting to talk about the larger landscape of our immune system and how well it functions or doesn't function. But there is a lot of understanding among integrative doctors who look at cancer from a holistic standpoint that says that acupuncture can be a really powerful tool in your toolbox. So Rachel, again, we actually for the first 3 years didn't do acupuncture. I think for Rachel, there was something about the needles that was a little bit daunting. And so it wasn't until a few months ago when we realized with some blood testing that there was some hormone imbalance happening and some stuff with her thyroid, that it was recommended to try acupuncture as part of counteracting those things. And she did, and actually really enjoys it. Maybe soon we'll have a conversation, the two of us, where we can get her perspective. I don't want to speak to her perspective, but it's been something that is now just a part of of her lifestyle is to have acupuncture in her toolbox. And so we want to talk about that because we were late to the game, but want to make sure that you have those resources and don't wait 3 years potentially, because it I believe would have been pretty helpful as Rachel was going through chemo early on, but we actually didn't introduce it at that time. So comment below if you have any questions. Make sure you like the video as well. And if you haven't subscribed, go ahead and subscribe to the channel, because we're gonna have a lot more videos in the coming months, whether we're interviewing experts on specific treatment options, or talking through research like this video, or talking with cancer survivors and hearing their incredible stories and kind of bringing hope to this environment. So I wanna make sure that if you're interested in this, that you don't miss what's coming. With that, go try acupuncture and stay tuned for our next video.